What are the risks of bladder sling surgery? When considering bladder sling surgery for urinary incontinence, it is essential to understand the potential risks involved. This surgery, while effective for many, does carry some complications that can vary based on the type of sling used and individual patient factors. One of the most significant risks is bladder perforation. During the procedure, the bladder can be accidentally punctured by the needles used to place the sling. This happens in about 1 to 15% of cases, with an average occurrence around 5%. If this happens, it usually requires repair and catheter drainage for about a week. Another common concern is pain. Many patients report persistent pelvic or bladder pain, particularly with synthetic mesh slings. This pain can become chronic and may sometimes necessitate revision surgery to address the issue. Speaking of synthetic mesh, it presents unique risks not associated with native tissue slings. Mesh erosion can occur, where the mesh material can erode into the urethra, bladder, or vagina, leading to tissue damage and infections. Mesh migration or extrusion through vaginal or urethral tissue is also a possibility. In some cases, this can result in the formation of fistulas, which are abnormal connections between organs, and scar tissue formation can cause obstruction or discomfort. Urinary retention and obstruction are additional risks. After surgery, some patients may find it difficult to empty their bladder, which can lead to urinary tract obstruction. This complication sometimes requires further treatment or surgery to relieving the blockage. Speaking of urinary tract infections, they are relatively common after sling surgery, especially if there is mesh erosion or bladder outlet obstruction. Rates of recurrent urinary tract infections can be as high as 13% or more within the first year following the procedure. Bleeding and swelling can also occur during or after surgery. While these complications are usually manageable, they can sometimes require additional intervention. Rarely, nerve damage may happen, leading to pain or altered sensation. There are also serious but uncommon complications, such as intestinal perforation or severe infections, which can manifest as abscess formation or necrotizing fasciitis. It is important to note that while bladder sling surgery is aimed at treating stress urinary incontinence, it does not treat or cause bladder cancer. However, complications like mesh erosion or chronic inflammation could potentially affect bladder tissue health. Therefore, any unusual symptoms following surgery should be promptly evaluated by a healthcare professional. In summary, bladder sling surgery can be an effective treatment for urinary incontinence, but it comes with risks ranging from minor issues like temporary urinary retention to more serious complications such as mesh erosion and chronic pain. It is crucial for patients to discuss these risks with their healthcare provider, considering personal factors like future pregnancy plans, as outcomes can be influenced by childbirth. Always seek personalized medical advice to ensure the best care for your individual situation.